Hello, this is Marie-mccarterfrohna recording our final assignment, MO8 for medical terminology. The scenario: you're assisting a physician and scribing for him as he examines a patient that arrived in the emergency room. Paramedics report that the patient, Don Smith, date of birth July 1st, 1985, was an unrestrained driver in a motor vehicle accident about 20 minutes ago, with a chief pain in the left lower quadrant of his abdomen, left arm, left leg, and head. Patient denies any loss of consciousness or dizziness. Vitals were a BP of 165/84, the pulse of 108, and a respiratory rate of 24, a temperature of 96.8, and a pulse ox reading of 98%. Splints were placed on the left leg. The left arm is in a sling and the head was wrapped with gauze with signs of blood. For the integumentary system, assess the wound for the head for severity to determine if the depth is epidermis or if it's deeper with the dermis layer of hypodermis or subcutaneous layers. Full head-to-toe assessment to confirm any other cuts or abrasions, immediate pressure to the wound to stop blood loss. For musculoskeletal, the cranial will need to be assessed for any breaks in and around the cut on the forehead. Extremities need to be observed for any movement and pain. The arm, the ulna, the radius, and the humerus. In the leg, they need to look at the femur, the tibia, and the fibula. X-rays of the left arm and leg to confirm no fractures. For cardiovascular, the pulse rate was 108 and the blood pressure was 165/80, could indicate a cardiac arrhythmia. Also, elevated BP and pulse could be related to pain. EKG needs to be done to confirm normal heart rate and rhythm. For the respiratory system, the left side pain needs to be assessed. The fact the patient was not wearing a seatbelt could indicate the need for testing to rule out any mediastinum contusions, and a chest x-ray would be the best source for that particular rule. Left lower quadrant pain could indicate damage to the gastrointestinal area. A nasogastric tube should be inserted to prevent any blood or gastric fluids to collect. Complete visual assessment would be helpful to help triage the vast area. Auscultation and palpation of the abdominal region can be used to determine a more defined area to focus on for pain in the abdomen. Reproductive, because of the left lower quadrant pain, I would suggest palpation of the bladder to determine if the bladder is distended. A quick ultrasound of the bladder could be used to confirm distension. A Foley catheter could be inserted into the urethra through the penis to prevent distension. Nervous system, the injury to the forehead needs to be assessed for any injury to the brain. The frontal lobe controls motor function, personality, speech. A lumbar puncture could be completed for an anesthetic route for pain management. A CT scan would be the best diagnostic test to rule out any brain injury. Endocrine, left lower quadrant pain could also indicate damage to adrenal glands. Contusions to the kidneys need to be ruled out. A pancreas function study should be completed to rule out any injury. Blood serum levels could be ordered to rule out any damage. In summary, patient would need a CT scan of head, chest, and abdomen, ultrasound of abdomen and bladder, multiple lab. Patient was diagnosed with a mild CVA, which caused the patient to black out during the drive, but is stable and on new anticoagulant therapy. Only bruising and mild contusions to the extremities and forehead from the accident. And then my references are listed as well in the PowerPoint for medical terminology, a living language, chapters 1 through 12 as the reference.